Hello and greetings from North Chicago, Illinois in the US. My name is Dr. Noah Rosenblatt, and I'm excited to present to you today my work entitled Step Length Asymmetry is Associated with Fear of Falling Activity Avoidance in Persons with Unilateral Transtibial Amputation. There are no conflicts of interest to present. So as everyone is probably well familiar, low balance confidence and the associated fear of falling are common problems in lower limb prosthesis users. The work of Miller suggested that the average activity-specific balance confidence, or ABC score, is in lower limb prosthetic users is approximately 64%, and almost 50% of prosthetic users endorse the fear of falling. Collectively, this is problematic as low balance confidence and fear of falling can lead to activity avoidance, in turn increasing disability, reducing quality of life, and further increasing fall risk. In intact older adults, a considerable amount of work is focused on identifying spatial temporal kinematics that are able to predict fear of falling. However, less is known in terms of prosthetic users with fear of falling. One characteristic of gait that's common in prosthetic users is gait asymmetry. In particular, with regards to individuals who with transtibial amputation, step length asymmetry is common and tends to result from decreased push-off of the prosthetic limb, leading to relatively shorter non-prosthetic step lengths relative to prosthetic step lengths. While this might be argued to represent a maladaptation as a result of an amputation, a study by 2018 by Howjick et al. Suggests the opposite, that it might be beneficial in terms of providing stability. In particular, if we consider the margin of stability as the distance between the extrapolated center mass and the heel at heel strike, with the extrapolated center mass representing the position plus normalized velocity of the center mass, we can see how those interplay with prosthetic step length in this figure taken from the 2018 paper by Howjick. In particular, due to reduced prosthetic limb push-off, the velocity of the center of mass is reduced, and as such, unless step length is reduced, margin stability will be smaller. So by reducing step length, you actually increase that stability margin. And so again, step length asymmetry might be a beneficial adaptation. Accordingly, we were interested in evaluating the extent to which step length asymmetry in individuals who use lower limb prostheses was associated with balance confidence as well as similar related constructs. And we also sought to evaluate the relationships with other measures of gait symmetry and these constructs. We hypothesized that individuals with low balance confidence as well as low gait self-efficacy and high fear falling avoidance behaviors would rely more on step length symmetry index as an adaptation to improve stability. We tested this hypothesis by recruiting 20 participants with unilateral transtibial amputation who were recruited as part of a larger study looking at the extent to which an intervention can actually reduce fear avoidance behaviors. And therefore, as part of that intervention, we recruited individuals who self-reported an ABC score of less than 80 over the phone. The additional inclusion and exclusion are shown here. Participants completed 4 self-reported measures, the ABC scale, the PEQ wellness scale, as well as the FFABQ, or fear of falling avoidance behavior questionnaire, which was chosen because it's one of only 2 scales we are aware of to quantify the construct of fear avoidance behaviors. And they also completed the modified gait self-efficacy scale, which is similar to the ABC scale, but focuses only on gait and therefore may be more relevant to the purposes of this study. In addition, participants underwent a standard gait assessment in the laboratory, from which we obtained 5 spatiotemporal gait kinematics and associated symmetry indices. We then correlated symmetry indices with each of these self-reported outcome measures. Here are the results with regard to step length and step length asymmetry. The table shows correlation coefficients and p-values in parentheses, and the bold values are significant. All of the self-reported measures were significantly correlated with prosthetic step length, with greater step length associated with greater outcomes. With regard to the hypothesis and step length symmetry index, only FFABQ was significantly associated, although the association was negative, which can be seen in these figures. On the left, we see FFABQ on the y-axis and step length symmetry index on the x. Higher FFABQ is associated with more negative symmetry indices. also seen graphically on the figure on the right, where the prosthetic and non-prosthetic step lengths are plotted as a function of each other, and the line of unity is shown. The majority of points actually fall under that line, indicating greater non-prosthetic step length. And particularly, we see larger circles under that line because those are individuals with larger FFABQ scores. Regarding the other symmetry indices, only single support time symmetry index was associated with one of the outcomes, which was ABC scale, whereby individuals with higher balance confidence tended to have greater relative prosthetic single support time than non-prosthetic single support time. So collectively, we saw this association between step length symmetry index and FFABQ, but in the direction opposite as what we might expect, whereby larger, not smaller relative non-prosthetic step lengths were associated with these fear behaviors. And this might reflect our population, which was individuals who already identified with low balance confidence. It's also worth noting that this construct, this idea by which step length symmetry indices may facilitate stability was specifically related to the push-off concerns that might exist rather than fear of falling. So the extent to which it extrapolates the fear of falling is not necessarily clear. And it also our results also suggest that fear of falling might reflect more lack of confidence in the prosthesis than anything else, as demonstrated potentially by adaptation to prosthetic step length and by the associations we saw with regards to single support time symmetry indices, whereby lower confidence was associated with reduced relative time spent on the prosthesis. Overall, it's possible that step length symmetry indices may serve as a marker of fear of falling avoidance behaviors, though more work is needed to better understand that relationship. And in particular, we hope to look at the extent to which our intervention is able to, or by which changes in fear of falling through our intervention and fear of falling avoidance behavior are associated with changes in step length symmetry index to better understand this association. With that, I'd like to thank our funding source and open this up to questions.